Let's go over Hordeolum versus Chalazion. Hordeolum is synonymous with a stye. And so what is a hordeolum? What is a chalazion? What's similar? What's different? So a stye or a hordeolum, external hordeolum, is like a little pimple on the edge of your eyelid, basically. And it's usually caused by a little bacterial infection there, just on the edge. So how do you treat it? Well, usually it doesn't require a whole lot. They always talk about warm compresses, so just put some warm packs, hot packs on it, and give it time. Use maybe some baby shampoo to clean the edges. And if you come in, to see me in the emergency room or urgent care or something, then maybe I would also prescribe you some antibiotic ointment to put in your eye. And that's because it might not help much, but it's not really going to hurt much either. So topical antibiotics are pretty low risk. So worth a try. So those usually go away pretty easily, no big deal, don't necessarily require specialty follow-up, and that's a stye or, again, external hordeolum. So there's also something called a chalazion, so that's what we're contrasting it with. So that basically refers to if you have something that looks kind of similar, but it's more internal, like kind of inside the eyelid, not right on the edge of it. And those are usually when there's a blockage of what's called a meibomian gland, which is like a sebaceous gland related to the eyelid. Now, technically, a chalazion is not an infection. It's just like some kind of inflammation from the gland blockage. However, it can look the same as a internal hordeolum, which is an infection, and therefore you don't necessarily know the difference. So what's the treatment for that? It's pretty much the same as everything I just said for the stye or the external hordeolum, with a couple caveats. If it's a really big area that's involved, or if it's failed, several days of the basic treatment, then you might put the patient on PO antibiotics. Like if it seems like it's turning into cellulitis, or if it's like a large area that's involved, or it's refractory, not if the treatment's not working. And then the other caveat is if that doesn't go away on its own, then they need to see an ophthalmologist who might do some special injections or a incision and drainage or curettage or a biopsy or something like that if they have some persistent lump there on the eyelid that doesn't go away despite all the treatments. All right, so that's basically the difference. So in summary, if it's like on the eyelid margin, usually you can just be like, okay, we'll give you some topical antibiotics, but basically just use warm compresses and baby shampoo. But if it's more kind of further up into the eyelid, like a red bump or something, or a painful bump, then you can do the same treatments plus or minus PO antibiotics, depending on how big and how concerned you are for something like cellulitis developing. And then if it doesn't go away, see an ophthalmologist. All right, so that's a pretty concise summary. Hopefully it's helpful. And here's a playlist with all my other videos that I've done so far. And go ahead and subscribe to the channel if you find it helpful. Catch you next time.